Dr. Bobby John is the co-founder of the India Health and Wellness Summit. He leads Equitas Consulting. It's a group of professionals that would like to see health as an outcome of public policies and of their own good work. He served as the Advocacy and Public Affairs lead for the India office of the Bill and Melinda Gates Foundation between 2010 and 2011. I would now call upon Dr. Bobby John to come up here and talk to us about his idea of health. A round of applause for Dr. Bobby John, please.
Distinguished Chief Guest, Dr. Bhushan, Dr. Poddar, my colleague on the dais and many colleagues off it, and every one of you who has cared enough to join us to talk about India's health and wellness this afternoon, my greetings. This is our 5th edition. In the past 4 years, we have come together to talk about how India works together to secure health and wellness for everyone who calls themselves privileged to be here as an Indian. But as we get into our 5th edition, I want to leave us with 4 key thoughts, and I start with number 1. Primary care has to get a new definition. Particularly in our population structure changing, we will continue to have the largest cohorts of pregnancies and newborn children, as well as the what is primary for the pregnant woman and the newborn child is going to be different for what is primary for those that are turning 60 and beyond. We cannot afford any longer to define primary care by the structures we created and know as the primary healthcare centers as on date. If that is our emerging reality, we also have to move beyond the older distinctions between communicable and non-communicable health conditions. The new mantra has to become, number 2, reach fast and stay as long as is required. The hemorrhaging postpartum woman requires the same rapidity of response as an older person going into diabetic ketoacidosis or an impending suicide. Our health conditions also require us to stay longer. We can't just push the pill or vaccine and walk away from many conditions. Tuberculosis requires 6 months. HIV, diabetes, kidney diseases require lifelong engagements. Reaching fast requires a different orientation than for staying long. We need to reorient our healthcare workforce and structures to be able to respond appropriately. There is never a free lunch, but that doesn't necessarily mean people have to stay hungry. Creating health safety nets by pooling and managing public resources and managing risks through insurance mechanisms are seemingly opposite ways in which the same end is being addressed. How do people get the care they need without becoming poor? And so therefore, the 3rd mantra for this afternoon. Health is wealth. Disease episodes are profoundly impoverishing. We will hear from our chief guest more on this theme. Benjamin Franklin famously stated, an ounce of prevention is better than a pound of cure. I want to update it today to number 4. An ounce of prevention requires a ton of collaboration. We see how the air we breathe is killing us rather than sustaining us. We read how not having clean water and sanitation leads to Indian children not gaining height. By 2022, when the nation turns 75, the total hypothetical Indian will weigh 75 billion kilograms, requiring 150 tons of pure protein intake per day. It will require a lot of water to create and a lot of drinking water to swallow. That hopefully illustrates my point that prevention of the largest cohort of metabolic disordered people will require tons of planning, collaboration, and regulation. Our effort at IHW Summit is to help push these collaboration conversations forward, and I look forward to a full afternoon and evening of ideas and dialogue that move us collectively to secure the health of 1/6 of humanity, that is our nation, India. Thank you.